Hello, class. So our presentation is on HIV and HIV prevention. We are our group number 1. I am with Bianca Salas, Irene Avila, Monica Arredondo, Joana Lofredo, and myself, Pablo Borges. Next slide. So the issue at hand, as you guys can see here, Black and African people account for a higher proportion of new HIV diagnoses and people with HIV compared to other races and ethnicities. Black and African people make up 42% of 36,801 new HIV diagnoses in the United States. In 2019, African Americans were 8.1 times more likely to be diagnosed with infection as compared to the white population. And among Black and African American people, most new HIV diagnoses were among men. Next slide. So what are social determinants of community health? Healthy People 2030 defines social determinants of health as the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and work. Social determinants of community health greatly influence one's health, well-being, and quality of life, and contributes to a wide variety of health disparities and inequities. Next slide, please. Impact of social determinants of community health. Social determinants of community health significantly impact minority groups, including African American and Latinx populations. Among adults with diagnosed with HIV in the US, social and economic disadvantage was highly prevalent. County level measures of poverty, low educational attainment, low income, and low health insurance coverage among people with HIV and demonstrated associations between these individuals, social determinants of health, and HIV care outcomes. Next slide, please. So socioeconomic status, individuals with low socioeconomic status are more likely to suffer from chronic illness and other disparities as opposed to those living in wealthier communities. Lack of socioeconomic resources is linked to the practice of riskier health behaviors, which can lead to the contraction of HIV. HIV is a disease that affects those of lower socioeconomic status and impoverished neighborhoods at a disproportionately higher rate. SES indicators, including poverty, homelessness, hunger, and lower education, have also been associated with higher prevalence and mortality of HIV within the Black and African population. People who live in high poverty neighborhoods have less access to jobs, services, high quality education, parks, safe streets, and other essential ingredients of economic and social success. People of color, particularly African Americans, Latinos, and Native Americans, are significantly more likely than their white counterparts to live in high poverty neighborhoods, even if they themselves are not poor. While the US has an overall poverty rate of 11.4%, within the Black community, the poverty rate is 19.5%. Next slide, please. Education. African Americans with greater education attainment are more likely to report having been tested for HIV than those who have not graduated from high school. HIV positive patients with limited reading literacy experience difficulty comprehending medication instructions and are less able to track their daily medication doses. Poor literacy skills are closely associated with treatment non-adherence. Next slide, please. As far as food insecurity, Black and African American populations experiencing food insecurity at 3 times higher rate than in the white population. Due to the pandemic, food insecurity in the Black community increased. An estimated 24% of the Black community experienced food insecurity in 2020. Black and African children are almost 3 times more likely to live in food insecure households than white children. And among 2,353 HIV-infected participants receiving antiretroviral medication, 2.4% reported food insecurity. And as you guys can see on the diagram to your right, it just shows African American households who have higher food insecurities than the nation as a whole, which I found to be pretty surprising. Next slide, please. Living conditions. People of color are more likely to live in high poverty neighborhoods due to the extensive history of racial segregation in the US. In 2019, 16% of people of color lived in high poverty neighborhoods compared to 4% of the white population. In 2020, although Black African Americans comprise 12% of the US population, they comprise 39% of the homeless population. White Americans, who comprise of 74% of the US population, and only comprise of 48% of the homeless population. Lack of stable, secure, and adequate housing is also a significant barrier to consistent and appropriate HIV medical care, access and adherence to antiretroviral medications, sustained viral suppression, and risk of forward transmission. Unfortunately, these health inequities continue to drastically affect our African American and Latinx populations, and overall, addressing the social determinants of health can help to ensure all people, regardless of socioeconomic status, can live a healthy life. And I believe that's done with my part. I'm going to go ahead and pass it over to Monica.
Hello, everyone. Today, I will talk about community organized approaches, frameworks, and cultural competency encompassing this community health advocacy campaign. At the same time, African American women with HIV has reported experiencing a higher stigma. It has become one of the reasons for the community organized building efforts. I'm gonna focus on community organized. I'm gonna do through community organization. And the first community organization is a non-governmental organization, rights organization. Its approach strategies for working for this community rely on freedom, liberation, education theory. RISE draws on elements from community-based treatment education programs associated with improved adherence, led by a training peers counselor. Next, please. The other organization is a participatory research community-based, which is a partnership organization. And as a part of the community empowerment, this participatory research provides community ownership and support of the intervention. Community-based participatory research is an intersectional focus rooted in Black feminist social justice work to HIV prevention and intervention views race, class, and gender as a categories that interact with systems of social and power relations on society. Its approach is based on Jack Rollman's models of the concept of community organizing, which is the social advocacy model. So social action to reduce stigma among African American women's communities. Next, please. Now I'm gonna talk a little bit about cultural competency. The CDC referred to cultural competency as effectively operating in different contexts and altering practice to reach other cultural groups. And cultural sensitivity is employing one's knowledge, consideration, understanding, respect, and tailoring after realizing awareness on self and others encountering a diverse group. Next, please. Next slide. Thank you. Cultural competence, cultural competence and cultural sensitive is addressing by those community organizing, and as for example, rights organization addressing medical misrule, Black community by ecological theory, and use contracts which are individual leveled that focus in client-centered counseling to reduce adherency barrier by building treatment, knowledge, and adherency skill, self-efficacy, and motivation. Another control is the structural level that is to assistance to link to support service, for example, substances use treatment and housing assistance. Another mechanism for design a cultural congruent HIV intervention include adapted duality or role flexing, collectivist identity, indirect communication partner, and minstrel outsiders. Community-based participatory research centered in intersectionality of self-esteem. Self-esteem is considered an essential resource to attain resiliency to stigmatizing experience enhancement strategy among African American women to connect with their ethnic heritage, to instill pride and employ themselves in culturally relevant activities and cultural practice beliefs, values, norms, and ideologies. Thank you.
Hi guys, I'm Bianca and I'm going to tell you guys about asset mapping. Creating an asset map is a critical piece when it comes to assessing the community. In our map, we've listed some of the community's primary, secondary, and potential building blocks. We conducted our research by using Google Maps and aidsvu.org to identify resources and map community assets within Los Angeles County. By creating an assets map, we get a better image of the strengths and resources that Los Angeles County can provide towards our goal of HIV prevention. A needs assessment was conducted to identify the causes of the health concern and to understand priorities and to understand and prioritize the needs of the community. The needs assessment steps include determining purpose and scope, gathering data, analyzing data, identifying risk factors, identifying program focus, and validating needs. Our goal is to raise awareness of HIV and HIV prevention, and our focus was to prioritize the needs of Black women ages 18 through 25 in the Los Angeles County. After gathering data, it is evident that Black women are disproportionately impacted by HIV and account for the largest population of women living with an HIV diagnosis. Black women are also being diagnosed with HIV 14 times the rate of white women. There are a number of risk factors that are contributing to this health problem. The risk factors include having unprotected sex, multiple sexual partners, receiving unsafe injections, homelessness, poverty, lack of health insurance, and substance abuse. Black women currently account for 57% of new HIV diagnoses among women. It is important that we look at this data and do everything we can to prioritize the needs of this community and achieve health equity. In order to do so, some important factors that can be improved are education, prevention, testing, treatment, addressing stigma and racism, increasing funding, increasing accessibility to programs and healthcare. Here's our HIV and HIV prevention annual budget for 2022. We've listed our partnerships, which are Los Angeles County Department of Public Health, who contributed towards education and prevention, AIDS Healthcare Foundation, who contributed to educational supplies, Los Angeles County Health Services, who contributed towards the PrEP Coverage Act and preventative HIV services. And lastly, we have APLA Health, who contributed towards our podcast and flyers. And down below are all of our expenses with their corresponding prices and our final total at the bottom. Community organizing and building among diverse groups is a significant strategy that we use to educate and empower the community about HIV. When community organizing and building, we focus on what it is that makes our population diverse while also addressing the health disparities that our target population is facing. Our target population is diverse because it includes young women of color, specifically Black women who have the highest prevalence of HIV. While working with diverse groups, it is important to be culturally competent. According to the National Academy of Medicine, racial and ethnic minorities receive lower quality of healthcare than non-minorities. Study after study show unequal access to care and poorer health outcomes among certain segments of HIV positive populations. To be an effective organizer, these health disparities and racism must be addressed. In order to be culturally competent among diverse groups, we must educate ourselves on target populations and their attitudes, beliefs, and practices. We must be culturally aware, health literate, and culturally sensitive. We can encourage members of the community to participate and provide their knowledge. By including women of the community, we can help build trust and empowerment. And I'm going to pass it on to the next person.
Good day, Professor. Hello, everyone. Today, I'm going to talk to you about the approach that we took for conducting community participatory research. How it was done is through data surveys, government statistics, databases, and media information. Through this, we were able to identify the higher incidence of HIV in African American women. How now we can include the community in this campaign is by promoting community activities. For example, inviting members of the community to join with a couple of organizations that will be working collaboratively with us to support this cause. So briefly, this is what we found through surveys and opinion polls is that most Americans see HIV/AIDS as a serious problem that the whole country has to face. But unfortunately, only 4 out of 10 Americans know about the preventive medicine to reduce the risk of getting HIV. Additionally, through government statistics in 2019, it's shown that there is a higher prevalence rate of HIV infection for African American women. Also, through databases between 2006 to 2018, HIV diagnosis rates declined by 48% among Black females and 60% among Latin females. However, there are still high rates among Black females. Also, through media information is proven that is one of the most effective ways to prevent HIV, since now social media can reach the whole wide world. Through this, we plan to bring awareness by promoting HIV/AIDS services via either social media or the news. Next slide, please. So based on the previous data information assessment was done by evaluating the needs of African-American women community, and the findings are as follow. It was found that they face medical mistrust, discrimination and stigma, racism, HIV, stigma, homophobia, poverty, social and economic marginalization, residential segregation. Based on these findings, through the data presented before, it was planned to conduct intervention with the following: access to preventive medicine, better treatment programs, improving patient-provider relationship, more investing in healthcare and education for Black African-American women community, public investment to increase Black community home ownership. Can we change the slide, please? So how we plan the inclusion of the community with the collaborative partnerships is as follows. Through APLA Health Leadership, we're planning the participation of the community in weekly meetings, since it will increase their visibility in other communities and it will spread awareness of their presence and importance. Additionally, by offering different kinds of affiliations such as donations and volunteer opportunities. Also, through collaborative efforts with AIDS Healthcare Foundation that will be providing free HIV testing via van promoting events to facilitate testing in mobile locations. Additionally, there is services of pharmacies and healthcare centers. Also, they provide testings via healthcare centers. Can we please switch slides? Lastly, the last thing that we have is assets in these communities. How we plan to integrate the community in this is as follows. The primary on their assets are personal income in this community, which is roughly about 64,869. Secondary, we have Central City Association, Natural History Museum of Los Angeles County, LA Economic Development Agency, Martin Luther King Jr. Community Hospital, and collaborating with us, it's APLA Health, AIDS Health Foundation. Additionally, institutional within the area is Cal State, LADD, TLA, and UCLA extensions. Thank you.
Hi, everyone. I'm Irene. I'll be talking about the partnerships. As mentioned before, some of our main partnerships are the AIDS Healthcare Foundation, AHF, and APLA Health. Next slide, please. Okay, so the first partnership I'll be talking about is APLA Health, and the mission of APLA's Health regarding HIV is, quote, to achieve healthcare equity and promote well-being for the LGBT and other underserved communities and people living with and affected by HIV. And some services that they provide are benefits counseling, necessities of life program, healthcare services, housing support services, home health program, and case management. And to go into detail as what each of these things are, benefits counseling are assistance for all public health programs, If the client is eligible for the Necessities of Life program, it is free bags of groceries, which includes fresh fruit, vegetables, meats, eggs, cheese, yogurt, and canned and dry goods. Healthcare services includes getting and paying for HIV medications, access to dental care and counseling services, assistance with medication adherence. Housing support services are acquiring, financing, and maintaining affordable and appropriate housing. The home health program is personal and comfort care, including bathing, grooming, and etc. Case management is registration for eligible services within APLA Health. And the target for APLA Health is low-income individuals living with HIV. And they advocate for optimal HIV/AIDS and healthcare policy programs and legislation. They work with, all levels of government, local, county, state, and federal, meeting and speaking with elected officials, administrators, and other decision makers to ensure people living with or at risk for HIV have access to the best possible information. Next slide. Okay, the second partnership I'll be talking about is AIDS Healthcare Foundation, AHF. It was founded in 1987 and began as a hospice where their slogan was fighting for the living, caring for the dying. Since then, AHF turned hospices into healthcare centers and then began building a new paradigm for HIV care in both the United States and around the world. It is a global nonprofit organization that provides medicine and advocacy to 1,600,000 people in 45 different countries and is currently the largest provider for HIV/AIDS medical care in the world. AHF has a circle of care, which, as you can see here, healthcare and wellness center, pharmacy, food for health, out-of-closet thrift store, housing foundation, positive healthcare, and global advocacy. And going further into detail, AHF healthcare centers offer expert HIV care delivered by experienced and compassionate staff. Their pharmacy, 96 cents every dollar made out of the facilities. Food for Health is an innovative program that combines food pantry services. The out-of-closet thrift stores is world's most fabulous thrift store, known as Regulars, is the best kept secret in town. Healthy Housing Foundation is powered by AHF and provides stable, affordable housing units to those in need. And Positive Healthcare, if you have Medicare and HIV, you can check out PHP, the HMO. And advocacy is, their mission is, advocacy is written to the mission of AIDS Healthcare Foundation and drives the organization to fight for what they believe is right. Next slide. Thank you. So some ethical issues that need to be addressed would be socioeconomic status, education, food insecurity, and living conditions. It has been known that these are major factors in addressing HIV within the African American community. Another issue is that a lot of African American women have mistrust in the healthcare system stemming from experiencing racism, which causes them to not seek medical treatment or help. They also have medical mistrust in the healthcare as well from historical medical mistrust. So a lot of issues that happened in the past sticks with them and also does not help them in order to get treatment. What can we do to tackle these ethical issues is understanding race-based inequalities can help to gain the trust, and learning about cultural competency can make a difference on how to treat different patients. Next slide. Thank you.
So for our first item, we put together this flyer that addressed HIV testing, and we targeted young African-American women aged 18 to 25 in Los Angeles County. We included a statistic here that states 42% of all HIV diagnoses are among African-Americans in order to grasp the attention of this population. We also chose to hold our testing event on February 7th due to the fact that February 7th is actually National Black HIV and AIDS Awareness Day. So we found it to be fitting for this target population. Additionally, we included this photograph here in order for our target population to be able to view this flyer and to be able to relate to it, therefore catching their attention even further. Next slide, please. So for item B, we chose to conduct a podcast because we have agreed that recently podcasts have become very popular, especially among young adults, young females. We determined that this would be a cost-effective strategy for getting our message out to the community and catching the attention of our target population. Now we're going to play our podcast for you. We hope you guys enjoy.
Hello, everyone, and welcome to today's episode. Today's episode is going to be an educational one. We're going to be discussing HIV and really focusing on the African-American community since the population has the highest prevalence of HIV. I am Irene Avila, and today I have with me my colleagues Joanna Lopreto, Bianca Salas, Perla Laborde, and Monica Arredondo with me to help discuss. We're going to start off with Joanna, and she's going to begin by telling you a little bit about HIV. Take it away, Joanna.
Hello, everyone. My name is Johanna Lopreto. I'm gonna talk to you about HIV/AIDS. I'm gonna give you a brief description of HIV/AIDS and some of the symptoms. What is HIV? It's a virus that attacks the body's immune system. Where it came from? According to the CDC, it is an infection in humans that came from a type of chimpanzee in Central Africa. Studies have shown that HIV might have jumped from chimpanzees to humans as far back as the late 1800s. The chimpanzee version of the virus is called simian immunodeficiency virus. It was probably passed to humans when humans hunted these chimpanzees for meat and came in contact with their infected blood. Over decades, HIV slowly spread across Africa and later into other parts of the world. The virus has existed in the United States since at least the mid to late 1970s. Some of the symptoms of HIV include, according to the CDC, flu-like symptoms that appear 2 or 4 weeks after infection. But in some cases, people have no symptoms at all. Additionally, according to the CDC, there are 2 stages of HIV. Stage 1, acute HIV infection, which consists of having large amounts of HIV in the blood, and additionally, the person experiences flu-like symptoms. Stage 2 is chronic HIV infection. And in accordance to the CDC, in this stage, people experience infection or clinical latency. Additionally, HIV is still active and it continues to reproduce in the body. Many people also don't experience any symptoms at all during this phase, but they can still transmit HIV. The last stage of the disease is stage 3, which is the more severe. And people without any treatment in stage 3 of HIV can survive about 3 years at this stage without any treatment. Lastly, how do you know if you have HIV? The only way to know is to get tested.
Hello, my name is Monica Redondo, and today I'm going to talk about HIV, which is a daily infection disease. And a statistic has been showing that there is a disproportional in sexually transmitted infections, HIV diagnostic among young African-American women from LA County. They are affected by multiple levels of factors, such as the structural factors, including housing, poverty, and discrimination. Therefore, as a part of the community organizing and integration, we developed an advocacy campaign with other partnerships organizations to promote HIV prevention among this marginalized community. Hi, everyone. My name is Bianca Salas, and I'm here to discuss why HIV is prevalent among Black women ages 18 through 25. Young Black women are disproportionately affected by HIV, and there are a number of contributing factors. These factors include higher rates of poverty, lack of access to preventative medicine, health insurance, and education, which make it harder to find HIV testing and treatment options. Other contributing factors include medical mistrust, racism, discrimination, homophobia, stigma, and much more.
Hey guys, this is Perla. So there are many tools to help prevent HIV, and there are a number of ways you guys can reduce the risk of getting or transmitting it. Practice safe sex, or if you believe in abstinence, that's the best way to go. Safe sex doesn't only entail using condoms, but limit your number of sexual partners if possible. Also, avoid sharing needles, syringes, or other drug injection equipment. People who inject drugs are at high risk for getting HIV. So please, if you do use needles, ensure that you are using clean, sterile needles. And most importantly, get tested for HIV or any other sexually transmitted diseases. And please insist that your partners get treated and or tested too. Or have that talk with them prior to engaging in any sexual activity. It's nothing to be embarrassed about. Some agencies that we have partnered up with where you can go and get tested include AIDS Healthcare Foundation. They're dedicated to providing sexual health services in LA County. Services include free screening and treatment for STDs and HIV. APLA Health offers HIV and STD screening and treatment services specifically for low-income individuals living with HIV. The Los Angeles LGBT Centers also offer free, fast, and comprehensive testing for HIV and any other STDs. Additionally, my team and I have partnered with AIDS Healthcare Foundation and APLA Health, and we will be holding an event on February 7th at one of the AHF healthcare centers located at 4905 Hollywood Boulevard, Los Angeles, California, 90027. We will be doing free testing from 9 a.m. to 6 p.m. There will also be free food, music, prizes, and much more. For more information on STDs or a referral to other low or no cost clinics in the County of Los Angeles, please call the STD hotline at 1-800-758-0880. Thank you guys for tuning in on today's educational episode. Please feel free to give us a follow and stay tuned for our next episode. Bye.
That concludes our presentation, and we just have listed some references for the rest of the PowerPoint. Thank you guys for joining us.